Hi, this is Bob Roth, Managing Partner and Co-Founder of Cypress Home Care Solutions. Since 1994, we have been providing in-home supportive care services for our older adult population right here in Phoenix, Arizona. Since 2014, we've been bringing you a show on Money Radio called Health Futures, Taking Stock in You. In case you miss our show that airs every Friday at noon, you can catch it right here on our podcast called Health Futures, Taking Stock in You. So when you get a chance, listen in and enjoy the show.
It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures Taking Stock in You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. We're coming at you live from the Scottsdale Air Park Money Radio Studios, 1510 AM, 105.3 FM, and the World Wide Web, moneyradio1510.com. We're also podcasting now. You can catch us on any podcasting app. We ask you to download it. Please like us, review us, and please recommend us. So if this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. How do they do that? They do that by listening right here at noon every single Friday at Money Radio Studios. We've been on the air now for 13 years, and we are giving all kinds of advice, resources, and information to those people that are seeking ways for older adults to live as independently as possible and remain in their own home. And today is no different. Here it is, the first Friday in June of 2025, and I've got a good friend of mine here in the studio, Kanaan from Envoy America, and it's really good to have Casey here. You know, Casey, I will tell you, has been on our show. Casey, welcome back to the show. It's hard to believe that it's been, you know, when I look at the calendar, 3 years since you've last been here.
Yes, it's been a while, Bob, but I'm glad to be back.
Well, it's good to have you back. And, you know, to be honest with you, I have been in touch with you, but you have gone through, let's put it this way, a evolution, some changes. And like anything else, I mean, the industry is changing, the world is changing, and the world is aging too. I mean, 10,000 people a day are turning 65, and you know, at 2030, we're going to have more people 65 and older than 17 and younger. Isn't that crazy?
That is crazy.
Well, it's really good to have you back. And, you know, for our listeners that don't know Casey Kanaan and don't know Envoy America, can you quickly just give us a little background on you? When you were first here, it was a little over 10 years ago, and it was when you were just getting started. You were here with your co-founder, Andy Baran. And a lot has happened. So please, if you would, indulge me and our listeners, bring us up to speed where you're at, how you began, and we got a lot to talk about.
Absolutely. So like you mentioned, we are 10 years old as a company. We started this business because we could not find suitable services for our own parents to help them stay independent, healthy, socially active, because none of the services that exist today or existed 10 years ago are designed for older adults that might have cognitive challenges, mobility challenges, and they need more than just a ride to take them from point A to point B. So that's how we started this company. And we've been blessed to be able to expand through word of mouth to about 30 states, 300 cities, serving our clients through partnerships with senior living communities, healthcare organizations, faith-based, community-based organizations. So what we offer is services to help older adults, patients, either getting discharged from the hospital to go home or to a skilled nursing facility, go from a senior living community to the grocery store, outings, religious services, you name it. we replicate what a son or daughter would do to help their mom or dad, loved one, or their loved ones, to do the things that they want to do on their own terms.
You know, when you really think about it, you know, when we have loved ones that are aging, you know, the first sign of taking someone's independence away is when they take the keys away. And that's a really hard thing, you know, and I struggle with this, Casey, because so many kids today, like almost 40%, when they turn 16, they don't go get their driver's license. And you and I, when that happened, it was a rite of passage. We got to 16 and we were down there at the Department of Motor Vehicles getting our driver's license.
Absolutely.
And, you know, for this generation, that was what they went through. It's that independence, freedom. They could get in the car and go. And now they're not able to drive. And this is a resource. This is a company that you and Andy put together, and it has evolved several times over the last 10 years. And if you wouldn't mind, take us through some of those evolutionary changes. And I think a lot of that comes innately for you because of your background. And maybe even fill us in a little bit about your background, because you worked in corporate America in a really big way.
I did. So I'll start there. Both Andy and I worked for big companies like Intel. Andy worked on the finance side, was a senior executive, and I worked on the business side to help grow some of the businesses that Intel had. Worked for
small company.
Small, huge company,
Yeah.
Absolutely. Also worked for Bose Corporation, the audio company. Just help grow the business and manage the business. But our parents got older and they stopped driving and they needed somebody to help them.
Right.
So we've tried everything from taxis, Uber, Lyft, relying on volunteers, and nothing worked. And if you talk to any older adult who stopped driving, they will tell you today's transportation options are unreliable, undesirable. They're not designed with them in mind. People say, well, they can take Uber or Lyft. Yeah, Uber and Lyft are designed for people like us who just want to get from point A to point B. But older adults who have been driving for 60, 70 years, doing the things that they want to do on their own terms, whenever they want to, and now they stop driving and now they have to rely on others, on services that are not designed for them. So if you think about somebody who's using a mobility device like a walker or transfer wheelchair, taxis, Uber, Lyft are not, their drivers as good as they are,
Right.
They're not trained to stow a walker or wheelchair. They're not designed to walk to the door. That's not their business model. That is our business model, and that's what we do day in and day out to help this 30 million or so older adults or patients that need more than just a ride. And we've been blessed to be able to do this. We've been blessed to be able to grow. We've been blessed to be able to help healthcare organizations address the patient throughput problem, and I would love to elaborate more on this.
Yeah, on
if
the
we
second
have time.
segment, we're going to get into that. For
Absolutely. But yeah, it's a big problem that we're solving and have been solving.
Well, you know, and it's been quite a journey. And, you know, for me to watch the evolution of Envoy America, I mean, look, you know, we are in a society today that is changing so rapidly. And if you are not dynamic and you don't have that ability to pivot and evolve, you're obsolete. And the evolution that you guys have gone through is nothing short of phenomenal. And I'd love for you to talk a little bit about that, because there are a lot of lessons learned. I've learned a lot of lessons at Cypress, and I know you've learned a lot at Envoy America. So,
Love
Casey
to share our
Kanaan,
experiences.
it's so great to have you here in the studio. We're one down, and as you know, having been on this show 4 times, we got 3 more to go.
3 more. Wonderful.
We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. And if you're just tuning in, we're in our second segment. I've got Casey Kanaan here in the studio with me. He's got a company called Envoy America, and they are absolutely changing the way and the shape and form how older adults can age and do it in a successful way and be independent and really solve for that transportation challenge, because most older adults who can no longer drive are really feeling isolated, social isolation, and they're not really engaging with other people. And to have resources like Envoy America is a true gem in our community, not just here in Phoenix, but multiple cities and multiple communities. I know Casey will share that. So I've teed up the second segment to really have him talk a little bit about the evolution of Envoy America and really lessons learned. We learned lots of lessons, and I was sharing my own vulnerability at the end of the first segment, saying that we've learned a lot of lessons as well. And we're in this new economy, and things are changing so rapidly, especially with the advent or availability of artificial intelligence, large language model type machine learning. There's just a lot of cool things that are happening out there, and I think Casey Kanaan is right there on the front edge.
It's been quite the journey in the last 10 years, and you're right. We did evolve over the years. When we first started, the focus was on the older adults that lived at home, wanted to solve a problem for our own parents, and we were trying to find the older adults that looked and acted and needed the service like our own parents. But that became a struggle. Everybody knows older adults are hesitant to try new things. It's hard to reach them. Their kids, like us, would tell them, don't answer the phone, somebody's going to scam you. So it was a struggle at the beginning, and we had to evolve, we had to pivot, and the evolution was to focus on businesses that served older adults. And that's senior living communities, that's faith-based organizations, that included hospitals and healthcare systems that needed a reliable service to take care of the older adults. So we started serving senior living communities, from assisted living to independent living, to help communities that have healthcare centers, to help them deliver better care to the residents. The second evolution came when these communities started talking to us and say, well, we have this fleet, we're not in the fleet business, we're doing it because there's nothing else that's available, that's reliable, that we can rely on. Would you take over? And that was a big aha moment for us. Can we do this? And we started working with one of our partners, LifeSpark in Minnesota, and they felt so confident in our ability to do this that they sold every vehicle that they have, every bus, every car, and outsourced everything to us. And to everybody's astonishment, we were able to help them achieve many great results, from deliver better care to their residents, to help them reduce their expenditures by half. If you think about it, every vehicle that they buy, if it's a bus, it's $100,000 to $150,000 that gets used once, twice a week, so it's a bad investment. With us, they don't need to do this.
Right.
If you look at their operating expenses, from starting with hiring the right people, training them, background screening them, to managing them, to paying for gas, insurance, that's all eliminated by outsourcing it to us. Help mitigate the risk. If you think about it, if their drivers get in an accident or if they're speeding, the community is liable for this. With us, we install technology in the vehicles to monitor the drivers' driving habits, from are they using the phone when they're driving? Are they using the seatbelt?
Is that with cameras?
Cameras
on the front ways and backwards.
Absolutely.
So you can
dash
see
cams.
inside the car and outside.
And telematics, so if they're speeding, going over the speed limit,
Nice.
everything is detected. And again, it's technology that we developed ourselves, and also brought in technology like Azuga to help us do this. If you add all of this, it provides great benefit to a senior living community. And that's what we've been doing, and doing it at scale
Wow.
across the country. If you look at a senior living community that has a health center that is relying on hospitals to send them the patients that are getting discharged from the hospital, they're relying on transportation that's unreliable. So when the physician makes the decision, okay, we're releasing or we're discharging Mrs. Smith at 10 o'clock, it might take 6-7 hours to find a wheelchair accessible vehicle or a vehicle that can accommodate a stretcher to bring it to the SNF. We have a solution, again, that evolved over time, that when they make a decision, the vehicle is allocated to them within minutes. They can go pick up the patient, bring him to the SNF. So again, if you look at it, it is a financial proposition. Spend a few $100s a day with us, $300-400 a day. For every admission that you get to your SNF, you're getting about $15,000 to $20,000. That's roughly 3,000% ROI. So we're solving major problems for the senior living communities, but also for the hospitals and the healthcare systems. If they can't discharge patients, they can't admit new patients. So they can't, and their staff, their discharge nurses, their social workers are chasing after transportation to find somebody to come in and take that patient. We solve this problem. We solve it through dedicating vehicles to the hospital or the SNF, through technology, so everything is done within minutes versus let me call, let me email, let me send a fax. Some people still send faxes. We solve this problem, and we're doing it at scale for hospitals and for senior living communities.
And not-for-profits, too.
Absolutely.
And you're doing not-for-profit work. You know, I got to tell you, it's been a long time since I visited your website. And, wow, I'm really impressed. Talk about evolution. I love what you have here. You know, obviously, you know, the vertical that you're in is transportation solutions for patients and older adults. But I love I'm going to say this is probably your tagline, caring humans using technology to empower health, connections, and independence. And truly, that's the challenge we have. I mean, we've talked about it here on our show. 1/3 of our population, 65 and older, is living home alone. And that number increases up to 70% in the senior living communities. So, you know, you have someone that's in a SNF, by the way, that's skilled nursing facility, or they are in a hospital setting or in a rehab setting and they get discharged to home. There's a good chance there's no one at home to be able to give them that ride. And you know what? It's not unusual in markets that Envoy America is not there and people don't know about Envoy America, where they'll call a cab or an Uber, a Lyft to take this person, and you have no idea who this person is. I mean, let me give you an example. I told you I was just away. You know, I went to Southern California to visit my children, and I spoke at a really, really great conference that I got to attend, Home Care 100. It was in Monarch Beach, which is right there next to one of my favorite spots in the world, Dana Point. And I ordered a Uber, and I ordered it for a 5 a.m. pickup. I usually don't do that. I usually wait till like 4:30 in the morning, and I was like, the last time I did that, I had 2 Ubers cancel on me, and I really pushed it. So I ordered it the night before. The guy shows up in this really, really old car, and it was a Prius. And I had my golf bag with me because I was playing in the golf tournament. And the windows were all down. They were all down. And I said to him, you know, when we get going, can you turn the air conditioning on? He goes, the air conditioning doesn't work.
Wow.
This was less than a week ago. And it was early. It was like 88 degrees already. And we drove to the airport with the windows down on the freeway. Now, thank goodness my wife Susie wasn't with me, because she would have probably ordered another car, because her hair would have been everywhere. But you see this hair? My hair didn't really move, but that's the kind of drivers that you could get when you're dealing with Uber or Lyft, and especially if you're an older adult. So I really want you to spend some time maybe here closing the second segment. You can pick it up on the third.
Right.
Tell me about the people. We got about a minute, so let's tee this up and then come back to it in the second half, because really people are what make my home care agency and what make Envoy America So start in terms of how do you pick and select these people?
So I'll start by saying that our companion drivers, and we refer to them as companion drivers, they are the face of the company. If it wasn't for them and that the great work that they do, we would not have we would not be in existence. They replicate what a son or daughter would do. About 90% of them are between the ages of 40 to 60. They look at what they do as a calling versus a job.
Wow.
They're still getting paid.
Yeah.
About 67, 70% are women. We have great men working for us, but women are the caregiver, are the ones who take care of things when things need to be taken care of.
Kind of the same in my space.
Yeah, and 30% are veterans. We have a veterans first hiring policy.
Oh, I love that.
So
why don't we end on that?
Absolutely.
Because I really want to talk about the veterans, and I know that you are, and you have family. So you're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. We are at halftime here. I got Casey Kanaan here in the studio. Envoy America. Stick around. We'll be right back. I hope you're enjoying the show. This is your host, Bob Roth, managing partner and co-founder of Cypress Home Care Solutions. If you have any questions about the topics that are discussed during the show, visit us online at cypresshomecare.com or give us a call at 602-264-8009. We are entering now the second half of our show, so stay tuned for more helpful information to assist you with your aging loved ones.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we are in our second half here, and I still have Casey Kanaan here. He's here making a fifth appearance to Health Futures, and I'm really excited to have him in the studio. You know, if you missed that first half, go up to our website at cypresshomecare.com. Click on the media button right below it. You'll find radio show. You'll catch this one and many, many more. And as we teed off the show, I mean, he was on 10 years ago when he was just starting. And we talked about a lot of things, but I really want to dig in now because we ended the second segment talking about the people that you hire. And you said about 30% of the people you hire are veterans. So you have this Veterans First campaign, and you're a veteran, and your son's a veteran. And I mean, I have nothing but great respect for the work that you guys have done, and I love that you're giving back to our veterans.
Thank you, Bob. If we have any veterans listening, thank you for your service. Just a minor thing. I'm not a veteran.
Oh, I thought you were.
I am a proud
father of a
veteran.
There you go.
Jimmy, who is our COO, is a veteran, and we have a large number of veterans that work for us in the office as well as companion drivers. We're proud of them, and we're proud of their service.
I love it. And you wear the pin. You've got the American flag, and you've got the Marines flag.
Absolutely.
Semper Fi.
Absolutely. Our son and Jimmy both are Marines and great individuals.
I love it. I love it. And I love that veteran first mentality. And we certainly at Cypress Home Care, we have a big veteran effort to really get care for these folks who, like you said, that have served our country, and we so respect and appreciate the work that they have done to give us our freedom.
Absolutely. But Bob, again, just going back to when we first started this company and all the mentoring discussions that I've had with you and all the guidance, I mean, the processes that we have to find the right people and hire the right people, you had a lot to do with influencing how to look at who's on the bus and who's not on the bus and what to look for. So I want to give credit to you for helping guide us and help teach us what to look for. And it all starts with asking a simple question: what prompted you to apply? And if somebody says, well, I get what you do, I've seen my mom, dad, neighbors struggle because of transportation in our case, or because there was no one there to help them when it comes to home care, then that's somebody that we want to continue the conversation with. But if they lead with, I saw that you pay $22 per hour or 25, whatever the number is, you know that this person is not, their heart is not in the right place. Yes, they might be great people, but if it's money that's the first thing on their mind, they're not the right people for us, because the people we serve, the older adults, the patients, they need somebody to take their time to understand that when you get older, you're walking a little bit slower than when you were in your 20s, 30s, 50s. Your hearing, you might be hard of hearing. You might be challenged, lonely because you lost your spouse, and you need more than just somebody to drive you. You need somebody to treat you like family, to listen to you, to ask you questions, to see how is your day, to listen when you give answers, not let me rush and take you, drop you off because I want to get the next person so I can make more money. But again, it goes back to you had a lot to do with help guide us in the selection.
No, thank you. It's interesting. As I shared with the audience last segment, I just came back from Southern California visiting with family and attending this great trade conference. I checked into this one hotel because I was staying up in LA because I was visiting with my daughters and her fiance that live in Santa Monica. And I brought my golf bag and I brought a couple other bags, and I got greeted by this older gentleman. And he said, "Can I help you?" And I was like, first instinct was, I got it, because this is the exercise I get.
Right.
And I was like, you know what? Sure. The guy couldn't have been nicer. When I tell you that he was an immigrant here, came over to this country about 29 years, actually 39 years ago, and still had a very thick accent. He's from South America, 85 years old.
Wow.
I spent 20 minutes talking to him when I got into my room, and he was telling me that he really didn't have to work, but he chooses to work because this gives him purpose. This fills his cup. He loves people. And here he is. He lifted my golf bag. It had everything. And I'm like, no, I got that. He's 85, bent down and picked up my bag. I felt really bad that he was doing that, but he was insistent that he helped me. But, that is how we really need to be looking at aging. And here's a guy who was full of life. And here he is in the last chapter of his life. And he is living it with purpose. And I got to tell you, that's what I want to be.
Absolutely.
That's what we all should be, is living each day with purpose like that gentleman did.
No, that's a great story. That's a great story.
So I'm looking at your website. So, we talked about evolution. So what we offer, you offer 4 different ways to engage with you: subscription service, outsource model, full management, and on-demand service. I love that. I mean, you have options. Now, you're not in a B2C model. You're in a B2B. B2B in the sense that you're working with hospital systems and post-acute systems, and you're working with not-for-profits, and you're working, with faith-based stuff. I want you to talk a little bit about that. That's really cool, because I don't think you've ever dropped away from that core, because that's beside the not-for-profit, faith was another vertical that you went after right from the beginning.
Absolutely. One of our very first corporate clients was and continues to be the Jewish Federation. We started right here in Phoenix. The Federation back in 2015 was looking for a provider to help take care of the roughly 300,000 older adults, Jewish older adults that lived in the Phoenix metro area, to help them do the things that they needed to do, from going to the grocery store, hair salon, barber shop, go do their taxes, obviously go to religious services, go to the JCC. And they've tried different services from Uber and Lyft, and nothing worked. And they've heard about us, and they said, "Are you interested to look at this?" It was Mr. and Mrs. Jablin that funded the program, and that's how we started. And we continue to serve the Jewish Federation in different states, not just
just here. I mean,
Absolutely. We're here in Phoenix, serving the Federation in Phoenix, Tucson, New Jersey, and so on and so forth. But it's a great service. We take older adults wherever they want to go. Sunday is a very, very busy day for us. I never thought about it, but if I stop driving and there's no way to get to church, I'm going to stop going to church.
Right.
So we work with a lot of church partners that pay us to bring older adults to service, Easter, Sunday morning.
I love it.
Wednesday night. And the model, you talked about the 4 types of services we provide. This is more of a subscription service where one vehicle can serve multiple older adults. I mean, most people go to church that is close to where they live,
Right.
5, 6, 7 miles. So we can pick up Mr. Smith and Mrs. Jones from their home, take them to church, 10, 15 minutes, drop them off, make sure that they're safe inside the church, go pick up another 2, 3 individuals, congregates, take them to church. We stay with them if needed, if they have cognitive challenges. We become an extension of the church.
I love it.
And if you look at the cost per individuals, it comes to roughly $6, $7 compared to if you're going to hire Uber or Lyft. You're going to pay 5 times more per
At least.
individual.
I was going to say $40 to $50.
So we're helping the church, we're helping the congregates go to religious services,
it.
and we're saving them money, and it's a win-win-win for everybody, including us.
You know, it's interesting. I remember years ago going to a Yom Kippur service. It's a high holiday for the Jewish, community, and there was a guy I knew, and he had somebody sitting with him. And when we were getting ready to leave, I went over to say hello, and that person sitting with him was one of your drivers. And was there with him. It was a beautiful thing to see. I want to tee up the 4th segment. You and I, we're friends. You're Palestinian. I'm Jewish. We'll leave it at that. 4th segment coming up. Stick around. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures Taking Stock in You. If you're just tuning in, we're in our 4th segment, and I've got Casey Kanaan here in the studio with me. He is the co-founder and CEO of Envoy America, and they are changing the way people transport, a way they get from point A to point B, and I'm talking about mainly older adults. And if you missed the first 3 segments, go up to our website at cypresshomecare.com, click on the media button right below its radio show, or you can catch us on any of the podcasts. So I teed up this segment, and you and I have done a lot of public speaking, and we've done the show now for the 5th time, and we're brothers, and we are cut from the same cloth. You're Palestinian, and I'm Jewish, and you do a lot of work with the Jewish community, and I love that about you. You're from Palestine, and you lived in Israel when you were working for Intel. I would love for you shared with me that just last month, actually I think it was in April, there was a congregation of all the Holocaust survivors for Holocaust Remembrance Day, which is known as Yom HaShoah. Can you share that with us? Because you shared a little bit at the break, and it was I was like, stop. Let's share it with our listeners.
Absolutely. So you're absolutely right. We're brothers, even though we come from different religious backgrounds.
Mm-hmm.
But the way I've always looked at it is we're the same people. If we can communicate with each other and listen to each other, we can solve whatever problem we have, irrespective of our backgrounds. And that's why from the day we've met Bob, we got along. But my co-founder Andy also is Jewish, and we've always got along even before we started the company. As you mentioned, I spent a lot of time when I was with Intel, traveling to Tel Aviv and Herzliya. Intel acquired a company, and I worked very closely with Shmulik, or Sam, the CEO, to integrate the company, and was his chief of staff. Our lead investor in Envoy America is Joshua, great guy. Again, been very supportive. But to talk about the Survivors Remembrance Day, it was an honor for us to be able to serve approximately 30 survivors that, obviously if they're survivors, they're up in age, and take them to and from the event and listen to their stories on the way back. Obviously, many of them were emotional. Their emotion level was different going to the event than coming back, and just the way our companion drivers have listened to them, treated them, just gave them the space to share the stories, and what we've learned was amazing. They went through terrible times in their lives and survived it, and it was an honor for us to be able to help them go to the event and come back and do it in a dignified way.
And at the same time, I mean, every time I'm with a survivor, I learn something new. And the resilience that these individuals had, and the stories, I mean, as heartbreaking as they are, I mean, they persevered, and they're here, and the families and the legacies that they've left, I mean, are just nothing short of phenomenal.
Absolutely. And again, they, like you said, they went through terrible times, and you learn every time you talk to them. But also, any older adult that we served, that we learned so much.
Right.
I tell our team, they're walking, talking encyclopedias. What they forgot is probably more than what we know. And every time you talk to them about how they view life, if they fought in the different wars, they just their experiences, their work experiences, raising kids before the invention of the technology that we use today and take for granted. It's amazing, and it's a privilege to be able to serve them.
I look at each one of them, whether they're survivors or just aging adults that we have as clients. Each one of them is like a good book. Each one has lived an incredible life, and I love hearing their stories. And while we live very different lives today, and you and I are the same age, so we know how different it was back in the 70s and 80s and 90s and where we're at today. But it's amazing, what they've lived through back in the 30s and 40s and the 50s. So
you're right.
It's great to be a listening ear. We don't have a whole lot of time. We got a few minutes here, and Casey, I love having you back here on the show. And I know that there's probably a question I haven't asked, or there's something that you would love to leave our listeners, because 10 years is a remarkable feat for you, and you have evolved over those times and have learned. I mean, we've all gotten our nose bloody, and we've got that door shut in our face, and we've made that, or should I say, we paid that stupid tax.
Right.
But we're better for it. And I would love for you to share with our listeners some of those key learnings, some of those messages you might want to leave, or if there's a question I haven't asked.
Yeah, no.
That would be.
Every time I come here, Bob, or every time I see you, I really enjoy our interaction. But for us, the transportation industry is evolving, has evolved. The way things have been done, and I'm talking about the senior living community industry, where everything is in-house. They own their own fleet. This is the thing of the past. There are new ways to do things that can help deliver better service to the residents, reduce their costs, mitigate the risk, and bring them into the future of senior living. And we're leading the effort in doing this, and we're doing it at scale across the country. for healthcare systems, hospitals, skilled nursing, rehab centers, the patient throughput challenge is a big problem. And the way that some hospitals have done things in the past, where I want to wait for the insurance company to pay for this, or I want to wait for Medicaid to pay for transportation, is also the thing of the past. There are better ways of doing things, leveraging technology, leveraging outsource model, where yes, you are spending $200-300, but the payback, if you really look at it, if you're a CFO or COO or chief nursing officer, is in the thousands percentage compared to the few $100s that you're spending. I hope some of your listeners are in the healthcare field or the senior living,
You
they're
bet.
executives, and I know they are.
You bet.
I hope they would look at how this industry has evolved and how companies like us can bring tangible benefits to them to help take them into where the future of transportation is.
You know, I look at where we are, all right? Machine learning, automation, AI, you know, and there are going to be autonomous vehicles. They are right on their streets right here, you know, with Waymo.
Phoenix,
And
yep.
and we know that, you know, Elon Musk is doing robo-taxis in Austin, Texas with the plan to roll that out. But, you know, I say this a lot in home care. We need to automate the transactional stuff, but humanize the relational piece. And I feel like that's what Envoy America does. They humanize that relational piece, because it's not just the vehicle that's taking you there, it's that relationship and that conversation that takes place, that comfort, right?
You're absolutely right. It starts with the humans, but at the end of the day, we are a technology-enabled company. We've invested millions in developing our own technology to help us be more efficient, deliver better service, to able to save our clients money. It's all like you've invested a
Right.
ton in technology. We are doing the same and have done the same, and that's what's enabling us to provide better service.
Thank you, Casey Kanaan.
Thank you, Bob.
EnvoyAmerica.com. Thank you. Make it a great day. We'll be back next Friday.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.